Prior authorization and utilization review get used like the same word, and confusing them gets your addiction treatment claims denied. They are two different payer checks at two different moments in care. Both are about permission and medical necessity, but one happens before care begins and one repeats throughout it. Let us define each term, then show exactly where they differ in your revenue cycle. First, authorization, also called a pre-auth. Insurance companies require patients or providers to complete an authorization process to gain permission to receive some treatments and services. Addiction treatment usually requires an authorization before care begins. Utilization review is different. It happens during care, not just at the start. A utilization review ensures the insurance company agrees with your center's assessment of medical necessity, and that they authorize the introduction or the continuation of the level of care you are providing. Utilization reviews are best used periodically throughout periods of care. Here is why the difference matters. Medical necessity can feel like a moving target with some insurance providers. At adjudication, the insurer evaluates your claim for correct codes and medical necessity, then decides whether to accept, deny, or reject it. Miss the upfront authorization or fall behind on review, and a claim that should pay can be denied instead. So, let us put authorization and utilization reviews side by side. They differ in three ways: timing, purpose, and frequency. First, timing. Authorization is permission you secure before the treatment or service is delivered. Utilization review happens periodically throughout the period of care. Second, purpose. Authorization gains permission from the payer to receive specific treatments and services. Utilization review confirms the payer agrees the level of care is medically necessary, so it can be introduced or continued. Third, frequency. Authorization is an upfront step tied to the services you intend to provide. Utilization review repeats periodically as care continues, so each continued stay stays defensible. Both of these sit inside the same workflow, revenue cycle management. RCM describes the entire process of medical billing, from pre-auths to claim processing to revenue collection. Authorization at the start and utilization review along the way both feed the claim that finally goes to adjudication. This is where behavehealth.com helps. It is an all-in-one software solution for addiction treatment providers with native billing capabilities. Native billing capabilities are built into the same platform you use to run intake, clinical operations, and documentation. And it is backed by a team of claims processing professionals who specialize in addiction treatment billing. That team is on a first-name basis with staff at each of the top 10 insurance providers across the country, designed to keep your authorizations and reviews moving. So, as you work each case, keep the two reviews straight. Before care, confirm whether an authorization or pre-auth is required for the service. During care, schedule utilization reviews periodically so the payer keeps agreeing the level of care is medically necessary. Tie both back to medical necessity, since that is what the payer evaluates at adjudication. Stop letting confused authorizations and missed reviews turn into denials. See native billing, backed by a real claims team, in one platform. Book a 20-minute demo at behavehealth.com.